Hello. Welcome to our channel. Today we are going to talk about one of the antidepressants that is commonly used called tricyclic antidepressants. In this video, we are going to cover what TCA is, mechanism of action, different types of TCA, uses, side effects, and discontinuation symptoms. Tricyclic antidepressants are a class of antidepressants that were first introduced in late 1950s. They are one of the very first antidepressants introduced. They were named tricyclic because of their chemical structure contains 3 rings. In order to understand their mechanism of action, let's have a quick look on serotonin and noradrenaline. Serotonin is synthesized from the amino acid tryptophan. Noradrenaline, on the other hand, is synthesized from amino acid tyrosine. After release, serotonin and noradrenaline are transported back to the presynaptic neuron by serotonin transporter and noradrenaline transporter respectively. And this terminates their actions. TCA exerts its antidepressant action by inhibiting the reuptake of serotonin and noradrenaline at presynaptic neurons, which will increase serotonin and noradrenaline at synaptic cleft. TCA also block 5-HT2A and 5-HT2C receptors at postsynaptic membranes. There are 2 different types of TCA. Tertiary amines that have terminal methyl group in the side chain and secondary amines which do not have terminal methyl group. Here is a list of medications classified under secondary and tertiary amines. Secondary amines include dizipramine, nortriptyline, pratriptyline, and amoxapine. You can memorize them by using the mnemonic. Do not produce effect. The rest of the TCA are tertiary, so all you have to remember is the list of secondary amines. We will cover these different tricyclic medications later in this video. The secondary amines are said to have a lower side effect profile and act primarily on noradrenaline. The tertiary amines are thought to be better at inhibiting serotonin. You can memorize this by T for tonin. Now let's talk about the different uses of TCA. As we all know, they are mainly used in treating depression. Nowadays, TCAs are used less commonly for depression due to their side effects and toxicity in overdose. TCA has other licensed uses such as neuropathic pain and prophylaxis of migraine, especially amitriptyline. Nocturnal enuresis in children, by using imipramine, nortriptyline and amitriptyline. Clomipramine is used in the treatment of OCD. It is also used as adjunctive treatment of cataplexy associated with narcolepsy. Now, let's move on to the well-known side effects of TCA. In addition to antidepressant actions, tricyclics also inhibit many receptors at different sites. The side effects of TCA correspond to the type of receptors they block. For example, inhibition of sodium channels at heart will cause cardiac arrhythmias, especially delayed AV conduction resulting in heart block. Sodium channels inhibition at brain will give rise to reduction of seizure threshold, and in worse scenarios, coma. Inhibition of central acetylcholine muscarinic receptor by TCA causes memory impairment, whereas peripheral anticholinergic inhibition will result in parasympathetic overactivity such as dry mouth, blurred vision, constipation, urinary retention, glaucoma. TCA inhibition of H1 histamine receptor results in sedation and weight gain, thus it is best avoided in patients with diabetes mellitus. Lastly, inhibition of alpha-1 adrenoreceptor will manifest as orthostatic hypotension, sexual dysfunction and again, sedation. So, in general, we could say that TCA are pretty sedating medications. Here, the most dangerous and alarming side effects is cardiotoxicity. TCA can cause following ECG changes: PR prolongation, QRS prolongation and QTC prolongation. Among the TCA, lofepramine is considered low risk for arrhythmia, whereas amitriptyline and dofepin are considered the most dangerous in overdose. So, TCAs, except lofepramine, are best avoided completely in patients at risk of arrhythmia, e.g. patients with previous myocardial infarction, heart failure, etc. In addition to the above side effects, TCA can also have additional adverse effects such as tremor, altered LFTs, paralytic ileus, and black tongue, which is black and hairy appearance. The appearance may be alarming, but it is a harmless condition. Before we wind up, let's talk about discontinuation effects that often result from abrupt withdrawal of TCA. Tricyclic medications need to be tapered gradually. On sudden withdrawal, discontinuation symptoms can result, which can manifest as flu-like symptoms, insomnia, excessive dreaming. TCA, especially amitriptyline and imipramine, can give rise to these effects. We hope this video has been helpful to you. If you have any questions or suggestions, please leave it in the comments section. And make sure you like and subscribe our channel, because we'll be uploading more videos for you.